Mick Crumplin is a surgeon and an expert on medical history who rehearsed the actors and the director on Master and Commander. Nowadays, medics can heal complex fractures and fight infection with antibiotics. When a young midshipman is wounded in the movie, the only remedy is amputation. Using animal parts and with a surgeon's mate to assist him, this is how an amputation was actually performed.
Having cut the skin, we now cut the muscle in several sweeps in a circular motion because before the bone can be divided, we need to separate all the soft tissue down to the bone. The limb removal takes about 2 minutes. The whole operation takes between 15 and 20 minutes. There's a nice clean cut there, but there's more to do. Taking up of the artery to stop the patient bleeding when the tourniquet is released. Then the wound has to be closed and dressed with bandages. The patient knows that he's going to be in for a terrific amount of pain, but many men queued up begging for surgery so that they could live.
Naval surgeons often had little training. But Stephen Maturin, the doctor in the movie, is an exception. The men believe he can perform miracles. What the movie depicts is based on a real case of what's called trepanning, boring a hole in the patient's head.
There was an old seaman in the film who had a depressed fracture of the skull, which meant the bits of bone were pressing on his brain and irritating it and its linings. So he had to be trepanned to remove the broken bits of bone that were pressing down in his skull.
Stephen Maturin is regarded as a miracle worker when he completes the operation with a remarkable technique.
Basically, it was taking a silver coin whose dimension has to be larger than the actual trepan hole and putting screw holes around it and screwing it into the skull. And the skin will heal eventually over the silver coin. The skin of the head has a good blood supply, so this is not usually a problem. There was one example before the turn of the 19th century who lived to a ripe old age with a silver coin embedded in his skull.
The crew think he's wonderful and comment on the fact that he's no ordinary ship surgeon. He's a proper doctor, he is. In fact, I, of course, was concerned the audience could handle another operation. They'd already had an amputation. There's 3 operations in the film.
When he's accidentally shot, Stephen Maturin has to dig a bullet out of his own stomach.
The problem for any surgeon, whether he's doing the operation on himself or on somebody else, is first to feel how deep the ball has gone, because the rule is if you can feel it with a finger, it usually means that it's removable. So he would grip bullet retracting forceps round the ball and remove the ball gently from the body. But there is the ball, and this time we're very fortunate because we've removed the little piece of clothing that went in with the ball and would have caused deep infection.
It's shocking to imagine what battlefield surgery was like.